Dr. Hayes. Well, as Rich mentioned, I'm an employee benefits attorney with K&L Gates, and I spent a lot of time over the last year since this bill was enacted working closely with employers and industry groups about what does this mean to us, what does it mean for our business, what are we going to do about it, what does it look like down the road, what does it look like today. On your table, there are some materials which are more step-by-step materials that I've prepared for my clients. These are used more typically by the HR folks to go, okay, well, what do we need to get in our benefits materials today? What do we need to do and think about today? Since I don't have time to go into all of that today, so you can look at that. And there's also some other resources from government resources about the timeline, so you can see where this is going from today through 2014 and beyond when there's some more significant impacts for employers. Love or hate healthcare reform, one of the things that I do enjoy about it is for the first time it is really bringing people together within companies and with other groups. Top executives are actually getting involved and for the first time asking, what are we paying for? What's the return on our investment? And for healthcare, despite the fact that it's a significant cost of your labor cost, for some reason that's always just been a kind of more hands-off, we'll just let our HR department deal with that. So there's a lot more innovation going on. One of my clients, we meet once a month to talk with their lobbying team, their top executives, all of HR, and all their legal team to talk about costs, running different models from year to year. And they're actually heavily involved in Washington, D.C. with the retail industry groups and the staffing association groups that are asking Washington, D.C. for more clarity on some of the issues that affect employers. So I'll just hit a few of those because I'll call those the challenges of healthcare reform. One is, of course, what does it mean to provide affordable healthcare coverage to all of our full-time employees? The Act really anticipates a traditional workforce. We know who our full-time employees are. They're the people who work 30 hours a week. A lot of my clients have intermittent employees, temporary workers who end up not being so temporary, per diem employees. A lot of my healthcare organizations have per diem physicians that might work for them one day, for someone else the next 6 weeks, and then they're back. So there's a lot of clarity that needs to come out about what does it mean to be full-time? How do we determine that? We're supposed to auto-enroll every full-time employee. How do we do that? So stay tuned because we do think the agencies are going to give us more clarity on that. The second thing that's kind of a surprise to employers and really requires a change in your internal practices is that if someone goes from full-time to part-time status and you messed up and didn't put it in your computer so they've been getting health care for the last 6 months that they weren't eligible for, you can't retroactively take that back anymore. That was a common thing, so a lot of employers are really looking at that now and making sure we have systems in place because, especially if we're insured, we can't deny it because we're under ERISA law. We can't deny it. Is someone else going to be? Is our insurance company going to look at us with more scrutiny later and say, you did something you're not supposed to do, so we're not going to renew you next year? So it's a small issue that is taking people by surprise, but something we're considering. Other things, there's a lot of notices and enrollment materials that are required to be provided that, you know, right now, the current law already requires a lot of disclosures and notices that overwhelm employers. In addition, we're soon going to have to distribute a 4-page summary. How you describe benefits in 4 pages is a challenge. So I was talking about this in 6 minutes. But one of the requirements of that is that it's got to be culturally and linguistically sensitive. So you may have to produce it in another language. You may have to look at your various populations because you might have very varying workforces within your organization as to what that means for you. 105H non-discrimination rules. These are rules under the tax code that will now apply to insurance plans eventually. It's on hold for this year. But it will change common practices that we've always had of paying top executives or physicians or owners of companies 100% of their health care while everyone else gets 80%. That's no longer permitted, and there is a significant tax penalty if you continue to do it. So, opportunities. One of the things that I really like about this bill is that employers who have less than 100 employees who work 24 hours a week will have an opportunity to apply for a grant to start a wellness program. Large employers have been very successful with their wellness programs, but mid to small-sized employers, that's been a harder barrier to overcome. So now there'll be a grant process, the Health and Human Services or the CDC? One of those two agencies is doing it, Health and Human Services. They will have a process if you don't have a current wellness program in place and you meet certain criteria. So it's a great opportunity. The other challenge for mid to small size employers with that is having data that's significant to know, is this a wellness program that's going to work? So the CDC is doing a nationwide study, and they're going to study it long term so that our wellness program is not just a matter of throwing a dart up there and hoping it works, but maybe we'll have some data with smaller populations where we couldn't tell whether statistically whether this was working, but we'll actually have more numbers along the line of what large employers have had. So